This content is for informational purposes only. Accuracy not guaranteed. Please verify independently. We are not liable for errors, omissions, or results of its use.
My medication, it runs $20,000 a month without insurance. I make $800 a month. Oh, that will kill me. That would kill my friends. That would kill millions of people in this country if they lose their health care.
We're in California's District 22, a rural community in the state's Central Valley. This district voted for Trump for the first time in 2024, but now his policies threaten one of the benefits people here rely on the most.
While they have the masses enraged about Charlie Kirk, I feel like the masses have bigger things to be worried about. And it's a lot of people who are spreading so much hate, so much racism, and y'all don't understand. If you have a loved one that's sick, if you have a loved one that's old, they are going to be displaced by January of next year. There are going to be a lot of elders, a lot of seniors, a lot of people who are chronically ill on the streets with nowhere to go, right? They're going to be evicting these people. They're going to be sending them to shelters and stuff. And if you think that they won't put the sick out on the street, think again. They put people out on the street. I have seen them put people out of facilities. I have seen them pack up people's stuff and put them on a curb, and you cannot come back on the property, and the police assist with that. So if you think that they won't put your loved one out, if you think that you won't get put out, I promise you there are bigger things to worry about that's happening in this country. That's why when we see these people that spread and hate and they're being racist, everyone is going to be affected by what this administration is doing. Everyone is, right? Rather you are for it or against it, right? I guess it's easier to deal with it when you're in agreement to it, but I promise you that shit is going to hurt when you have nowhere to go and you're sick as fuck and you can't afford medication, you cannot afford to eat, you cannot afford to live, and you're racist. It's going to hurt, I think, in my opinion, but I don't know. What do I know?
I just want to hop on here real quick and ask my fellow nurses, are you happy? Because you know who you are. You know exactly who you are. My nurses who came into a profession where your job is to advocate, protect, provide care, and want to see and help people get better. Are you happy? You happy that you voted to kill off millions of people on their only medical lifeline that they had? Hard working people who dedicated at least 30, 40 years to the same employer to earn these benefits. Are you happy you just got them kicked off? You happy that you have them worrying about how they're going to afford their insulin? I mean, they already can't afford insulin on fixed incomes, but how are they going to afford it now? Most of these people don't have family. They don't have a support system they can call. And before you come on here, just know, I know, most of you nurses are MAGA. You won't admit it publicly for obvious reasons, but you're MAGA. And you voted for this shit. So I hope your little $200,000, $150,000 a year was worth it. Because I don't see the value in it. And if you're a nurse and you voted for this shit, you disgust me. Not only as a nurse, not only to the profession, as a fucking human being. You disgust me. And I'm not afraid to say it. Because these people are entitled to their benefits. And whether you think they're able-bodied or not, that's not up to you. It really isn't.
Oh, I don't want to pay for other people's health care and their bad decisions. Dude, what do you think insurance is? What do you think your car insurance premium goes to do? Pay for other stupid people's accidents. What are you guys not getting about this? Fix the healthcare situation. Wake up!
All right, folks. Remember when those red hat warriors were chanting, "Drain the swamp and build the wall"? Convinced Trump was going to fix everything without touching their precious benefits? Like, government's the enemy, except when it pays my bills. Fast forward to 2025, and boom, Medicaid slashed. Hospitals closing. Folks begging for help they voted to gut. These are the same proud bootstrapping types who backed policies that tank their own healthcare, deport workers, and spike costs. Now they're shocked when the bill comes due. Farming's tough. Rural life's no joke. But cheering on a guy who promised to not touch Medicaid while plotting cuts? That's next-level denial. This ain't bad luck. It's consequences. And today, we're diving into stories from real people feeling the burn, mostly in Trump country. They nailed it. These cuts hit everyone, not just the lazy. Time to face facts. Welcome back to Mind Mirror. Let's break it down.
My medication, it runs $20,000 a month without insurance. I make $800 a month. Oh, that will kill me. That would kill my friends. That would kill millions of people in this country if they lose their health care.
We're in California's District 22, a rural community in the state's Central Valley. This district voted for Trump for the first time in 2024, but now his policies threaten one of the benefits people here rely on the most. Do you know anyone personally who voted for President Trump but depends on benefits like Medicaid?
Oh yeah, I know a lot of people.
One resident who would be impacted by Medicaid cuts is 64-year-old Irma Arredondo, who voted for Trump in 2024. Irma has several chronic health issues, including type 1 diabetes. She's also a full-time caregiver for her daughter, who has cerebral palsy, and her sister, who has Turner syndrome.
Man, these MAGA diehards voted for family values like it was a bumper sticker. But now Irma's staring down the barrel, caring for her disabled daughter and sister, meds she can't afford without Medicaid. They screamed about waste in government programs, yet here's a farm worker poisoned by pesticides, putting food on tables, getting screwed by cuts they backed. Trump's crew promised protection, but delivered the biggest Medicaid slash ever. Billionaires get tax windfalls, while folks like Irma rot. Hypocrisy much? No handouts until it's your family. Support Irma here. She's spot on. This betrays the vulnerable. Rural voters, wake up. Your small government fantasy is killing your neighbors.
The medicine that my daughter takes for seizures, I won't be able to afford it. So we feel hopeless if those cuts come, What we want to do.
Irma was a farm worker for more than a decade. She believes that some of her and her children's health issues can be linked to the pesticides she was exposed to while working in the fields.
Look at me right now. Look at me how many sicknesses that I have. We got all in the fields. Where else? I feel like these stubby nuts in the back, But why? Why when we put food on their tables? Trump promised a lot of things. I thought it would be more family values and those programs that we really need here.
One of those promises was to protect Medicaid, which 67% of people in this district rely on. It's the largest percentage of any district in the entire country.
Classic MAGA move. Vote for the guy hollering about America first, then act stunned when he guts the programs keeping families afloat. Irma's right. Where's the family values in slashing Medicaid that 67% of her district depends on? They bought the lies. Now meds for seizures are unaffordable. And tying health issues to field pesticides? Dead on. Workers feed the nation, get poisoned, then lose coverage. Trump's not touching it vow? Total BS, as the bill proves. Rich get richer, poor get the shaft. Agree fully. This hurts the ones who need it most. MAGA folks, your tough love rhetoric bites back hard when it's your turn.
Can you guarantee that Medicare, Medicaid will not be touched?
Yeah, I have said it so many times, we're not going to touch it.
The yeas are 218, the nays are 214. The motion is adopted.
This bill represents the largest cut to Medicaid in American history. It will devastate vulnerable populations.
The largest tax break go to the wealthiest individuals. Are those your values?
No, that's not right.
Irma isn't the only one in District 22 who feels betrayed by the administration's plan to gut Medicaid.
The only people that are hurting are the poor people. People that really need the stuff. Elon Musk doesn't need it. Trump doesn't need it. And, billionaires don't need it.
They're making out big time with this, but they're hurting people in the process.
Spot on. These cuts hammer the poor, not the billionaires like Musk or Trump raking in tax breaks. MAGA cheered, "Cut the fat," thinking it meant someone else's benefits, not theirs. Now, rural districts that flipped for him feel the betrayal. No vote redo? Fair, but own it. Death panels via AI? Nailed it. Algorithms denying care for profit while Grok spouts right-wing nonsense. This is autocracy weaponizing tech against the elderly. Support this fully. It's dystopian, hitting vulnerable first. MAGA, your free market idol, just turned on you. Harsh truth, but you built this.
If we could go back to November, who would you vote for now, seeing what you see?
Vote either one.
You just wouldn't have voted.
None either.
Trump and the Republicans quietly created the first wave of death panels. I'm not being hyperbolic. They are launching a pilot program that uses artificial intelligence to decide whether Medicare patients get certain treatments. That means an algorithm, not your doctor, can say yes or no to care, to lower quality of life and the potential of inadequate medical treatment. But unlike the histrionics around the Affordable Care Act, private tech companies will actually get a cut of the money they save by denying treatment. The more care they block, the more they profit. At the very same time, Elon Musk is rewriting his AI chatbot Grok to parrot right-wing talking points. That's the same AI that spit out Nazi slogans before he pulled it back. If you've read my latest novel, Coded Justice, you know this is dangerous. When algorithms become the tools of autocrats, they become weapons used against the people. Medicare is our nation's promise to our elderly. But under this authoritarian regime, guaranteed healthcare for seniors is being secretly morphed into private insurance that can discriminate. And truth itself is being rewritten through algorithms. It's dystopian. It's wrong. And it's already happening in the pilot states of Arizona, New Jersey, Ohio, Oklahoma, Texas, and Washington. This is step 7 in the autocrats' playbook. Weaponize technology to strip away rights from the vulnerable, to control what people believe, and decide who counts. If we stay quiet, it won't stop with Medicare. It's another step towards autocracy. And our health and our democracy are on the line. So speak up.
Damn right. AI deciding Medicare treatments, profiting off denials? That's straight from a nightmare novel. MAGA backed the businessman who bankrupts everything. Now it's healthcare. Pilot in those states? Spreads fast, targeting seniors and disabled? Weaponizing tech to control beliefs and rights? Agree 100%. This morphs guarantees into discrimination. Rural voters who hollered government out now beg for it back. Harsh? Yeah, but your votes enabled this. Elderly promise broken. Autocrats win. Speak up like she says. Democracy's at stake.
You do not get free health care. You do not get free health care. Do you think that people who are 28 years old that can work and refuse to work should get free health care?
Congressman, a lot's been talked about Medicaid, health care, etc. A lot of countries in the world, Europe, Canada, they have health care for the people there. Outside, just now you said, you don't want to see a lazy 28-year-old get health care, whatever. My point is, every working and retired American should be entitled to health care. Would you?
Hell yes, universal health care like Europe or Canada makes sense. Why deny a lazy 28-year-old when billionaires dodge taxes? MAGA screams no free stuff, but bails out farms and cores nonstop. Can't afford Medicare expansion? BS. We waste trillions on admin bloat. Roll back ages gradually. It's doable. Support this. Every American deserves care. Period. Your pull yourself up mantra ignores reality. Jobs vanish. Costs soar under policies you voted for. Time to face it. Selective socialism for the rich screws everyone else.
Would you sign on or write up a bill for Medicare for all? We've got Medicare now. We can start rolling back the age 5, 10 years at a time. Would you support that?
We can't afford that.
Yes, you can.
This conservative mom is finding out the hard way. Rachel is a Republican from North Carolina. She's a mom to a severely disabled son named David. He can't walk, talk, eat on his own, or see well. He needs constant care, medical equipment, therapies, and surgeries just to survive. And Medicaid pays for all of it, including a wage for Rachel so she can take care of David at home. But now, you could probably guess, after voting for a party that's been cutting Medicaid for years, she's realizing those cuts are hitting her family now. She voted to take Medicaid away from other disabled people, never thinking the GOP would take it away from her son. Federal funding is being cut thanks to Trump's policies. North Carolina is cutting even more. And services like the one that pays her, David's therapists, and his doctors are all facing an over 10% pay cut. Even bigger losses are coming down the road with a projected $1.1 billion in reductions. She wrote, Medicaid is David's village. Hey, Rachel, why'd you vote to burn it down then?
Oof, Rachel's story hits. Voting GOP to cut Medicaid from others, then shocked when it bites her disabled son. MAGA's personal responsibility evaporates fast. Federal cuts, state slashes, over 10% pay drops for caregivers like her. She calls Medicaid David's village. Spot on, but why torch it? Agree. Conservatives preaching charity while gutting it? Opposite of moral. You voted for this. Now live it. Harsh but true. MAGA sees disabled as budget problems. Own the vote that harms your own.
In the same opinion piece that she wrote, Fishing for Sympathy, she says, I have a pen, and you have a phone, a voice, and a vote. David has none of those things. If you still believe that your dollars should go to care for people who can't care for themselves, then you have a moral responsibility to charity. Medicaid is that charity. If you're a conservative, the absolute last things you should be talking about are charity and morality. The administration you literally voted in is the complete opposite of having great morals and being charitable. Rachel, you voted for the politician that vowed to get rid of the programs that you and your family depend on. What a moron. You voted for a political party that sees David as nothing more than a budget problem. Some of the last people that Republicans ever want to help are people like David. She never thought the cuts would affect her family, but now they are. David doesn't have a vote, but she did, and she voted to support people cutting him off. Now I hope you enjoy giving your son the life that you voted for.
Gavin Newsom is calling out Donald Trump for betraying rural hospitals in communities that overwhelmingly voted for Trump. He posted this article here saying another California county is losing its only hospital after feds refuse to step in. And he says, heartbreaking, Trump continues to betray rural Americans, this time closing the one and only hospital in a county that he won by nearly 2/3. Since this hospital is closing, people that are having issues in this town will now have to drive 40 minutes into a neighboring county for critical care. Additionally, 150 healthcare workers are going to lose their jobs because of this already resigning and seeking work elsewhere. The federal government is taking away this hospital's critical access designation, which is 40% of its overall revenue, a gap too large for them to fill, forcing them to close down. And get this, it's all happening because of a newly interpreted federal rule. It requires critical access hospitals to be at least 35 miles from the next closest hospital when traveling by main roads. I mean, how ridiculous is that? This hospital is only 32 miles away, so it's 3 miles short of the required distance. But they're arguing they don't take that route to get to the hospital anyway. They take a different route which would meet that standard. However, of course, the federal government under Trump doesn't care, and they're still taking away their funding and forcing this hospital to close down. But I hope Republicans in rural areas see this video and understand what Donald Trump's priorities are. He's doing this to these rural hospitals so he can give billionaires more money.
Gavin's call out is fire. Trump betraying rural hospitals in counties he won big. MAGA hollered, drain the swamp. Now their only hospital closes over a dumb 3-mile rule. 40-minute drives for care, 150 jobs gone. Federal nitpicking kills access? Agree. Priorities are billionaires, not rural folks. You voted for this betrayal. Harsh wake up. Nursing homes at $10K/month. Without Medicaid, families drain assets to nothing. Spot on. Even if you afford it, systems strained. MAGA, your America First just closed your ER.
Nursing homes are about $10,000 a month. So if you can't afford that, you gotta be real worried about Medicaid and Medicare being under attack right now. And honestly, even if you can. If you've ever gone through the process of going to live in a nursing home or having a loved one go to a nursing home, you know that it's extremely expensive and that the way that many Americans are able to afford it is through Medicaid. Basically, how it works is that you have to pay down your assets until they reach a certain limit. That limit varies, I believe, from state to state, in some places as low as $2,000. So yeah, like you sell everything in your life. You deplete your entire savings, your funds, until you have basically nothing. And then Medicaid kicks in and pays for your nursing home. If you have ever taken care of an elderly parent or family member, you know that caregiving is a 24-hour job. It's extremely difficult, and it is not something everybody is able to do. Often, patients who are admitted to hospitals are not safe to be discharged without this kind of support. So what does this mean for everybody else? Longer wait times in ERs? There are no beds upstairs. Mima and Papa have been there for 3 weeks looking for a nursing home. We are going to be probably forced to do some pretty unethical, sad stuff. Because if we can't find placement for somebody because they cannot afford a nursing home, where are we going to send them?
Nailed it. Primary care closures flood ERs with preventable stuff, messing up hearts, everything. MAGA's bootstrap society means no safety nets, so talk family plans now. Filial laws might force estranged kin together. Agree. Doom's real big bill looms. Healthcare workers see it, sicker patients, longer waits. Even young folks hit by heart failure quick. Support this. Society's ills pile on underpaid case managers. Your vote's gut care. Now ER beds vanish for grandma's attack.
I don't know about any other healthcare workers, but I already can see the effects of primary care closures in my area on the number of patients who are coming into ERs and being admitted to hospitals real sick. Like, the heart is messed up and that's why I'm there, but everything else is messed up too. And I think a lot of people think they're going to be exempt because they're not older. But baby, a heart attack that causes heart failure, it'll take you there real quick. So yeah, since we collectively decided we're a bootstrap society where we don't have to take care of each other, I think everybody needs to be having real serious conversations with their family members about what to do in a case of an emergency like this. You don't talk to your mommy and daddy? You estranged? You better look up the filial laws. They might be moving him in. Sorry for the doom and gloom. It's just this big, beautiful bill is still looming over my head. My case managers, my social workers, everybody who's out here getting paid next to nothing to do all of the work to fix societal ills, please tell me what you're anticipating in the comments, because I need to know.
In my wildest dreams did I think taking a video of myself talking about going to Mexico for dental work was going to cause people to give me death threats and threaten me in my messages.
In all of my wildest dreams, I completely expected you to come on this internet and cry about mean comments, as if your vote didn't just wreck hundreds of thousands of people's lives, snatch away their jobs, strip them of health care, and in some case, literally get them killed. People are being brutalized, deported, and left to suffer because of the policies that you voted for. And now you want us to feel bad for you, Karen, because the internet hurt your feelings. Be so for real.
Karen whining about death threats for her Mexico dental trip after voting Trump and demonizing illegals? Spot on. Your vote wrecked lives, stripped jobs, healthcare, got folks killed. Now cry over mean comments? Be real. Admitting poor education, hubby failing financially, smuggling to the shithole she walled off. Classic hypocrisy. Exploit their labor, vilify immigrants. Agree. It's political. Always. MAGA, your border obsession bites when you cross it for cheap fixes.
Literally just wanted to post about how it was like cheaper to go to Mexico, and people are making it political because I voted for Trump. Like, I don't hate Mexicans. I just don't want illegal people coming into my country.
You got on here to admit to us that you're not educated.
We won with poorly educated. I love the poorly educated.
And didn't even understand that you were indeed voting for a healthcare system and that it is political. You also got on here to confess that your traditional provider of a husband has failed his family financially, and he's got his own wife smuggling herself into a shithole country across the same border she wants walled off just to get her teeth done by the same dangerous illegals she loves to demonize. A classic colonizer playbook. Go to another country, exploit their labor and resources to make your life better, but vilify immigrants when they try to come here to make their lives better.
It's September 12th, and if anyone was wondering, Medicaid no longer covers Planned Parenthood services as of today. Thank you to the federal government and their big, beautiful bill. So if you are one of the 1 million people that was using Planned Parenthood for things like STD, STI screenings and birth control, there's that horrible update. I know that Planned Parenthood nationally is still suing and taking the federal government to the courts based on this. But as of today, Friday, September 12th, Medicaid will no longer cover services. The Planned Parenthood closest to me in North Carolina posted on Instagram that they are still welcoming anyone to walk in the Planned Parenthood doors. And if you are a Medicaid recipient, they will walk you through what your options are. In the meantime, I'm going to be looking around and seeing what free services are available in the state of North Carolina to post them here to act as a resource for those who are using Planned Parenthood and or Medicaid recipients. And if you know of any, please comment them below.
I don't think many of you understand how even if you have privatized healthcare, you are going to be adversely affected by taking Medicaid and the Affordable Care Act from the poor and rural communities specifically.
Dead right. Medicaid drops Planned Parenthood coverage. 1M lose STD tests, birth control. Still suing, but doors open. Walk in. Free services hunt on. Even private insured get hit. Poor flood hospitals for basics like dialysis. No primaries left. ERs overrun. No beds for real emergencies. Agree? Invisible strings connect us. Docs leave. Waits soar. People die. MAGA. Your against yourself votes screw rural poor first, but ripple to all. Critical thinking time. Only rich escape.
Why, you ask? Because they are going to go to the hospital. The hospital's for emergency medicine, but they are going to be showing up trying to get prescriptions, blood thinners, dialysis, type 1 diabetes medication, basic routine care that they could have accessed at their primary care doctor prior, but now they can't. And these are life-saving medications. So what are they going to do? They're going to flood the hospital. That's what anyone who needs help would do. The hospital can't turn them away, and it's not a hotel, so they can't just say, get out of here. They have to treat them, which means hospitals are going to be overrun with not emergencies, but regular routine care. So when your grandma has a heart attack, there won't be beds. When your son breaks his arm, you are going to have to wait even longer while people access basic care that they had prior to this. That's why we did it. We did it because we knew we needed the emergency room to be for emergencies, and we wanted people to access affordable care where they are. I don't understand how you guys don't connect the invisible strings here. People are going to die. That's the final thing. And then once the hospital's workload becomes outrageous, nurses and doctors will leave. They are leaving. They're being poached. So when we say you're voting against yourself, that's what we mean. You have privatized healthcare? Awesome. I'm glad for you. But you are going to be adversely affected by the fact that rural and poor communities are losing their healthcare. And the fact that you don't see that tells me that you are not thinking critically. You have to open your eyes and recognize that the only people that won't be affected are the rich. Period.
Are you ready for your local hometown hospital, your nursing homes where your loved ones live at, to close down? Are you ready to lose your job that you've had for decades? Well, guess what? Because this big, beautiful bill has been passed, not only are millions of Americans losing health insurance, but hospitals, nursing homes, and other medical entities rely on Medicaid payments to stay alive. This is the largest healthcare cut in U.S. history. So geez, I'm really sorry. I hope you can find a place for your grandma, your grandpa, your mom, your dad, your sister, your brother to live. Honestly, I just hope that if you did end up losing your critical access hospital in the middle of nowhere to these cuts, that somehow you can survive the extra 30, 45, 60 miles away to the next hospital. You can thank your politicians, the Republicans, Congress, and President Trump for that. And if you're about to be upset that, gosh, Emily, I hate that you're being political, healthcare has always been political. I grew up in a Republican town with a critical access hospital, and I'm proud of my roots. But honestly, these politicians don't care about your healthcare, and they don't care if you die. All they care about is saving money, even if it's at the expense of your life and your loved ones.
Big, beautiful bill. Largest healthcare cut ever. Millions lose insurance. Hospitals, nursing homes close. Sorry for lost jobs. Distant ERs. Thank Trump, GOP. Healthcare's always political. Pauls don't care if you die. Just savings. Cuts to Medicare, Medicaid, SNAP. Tax breaks for billionaires. Wealth hoarders blind. Poor can't buy their crap. Agree. Backfires on core. Karma as sales tank. MAGA. Your votes hoard wealth up top. Gut benefits. Now pay out-of-pocket hell.
The government voted to cut Medicare, Medicaid, and SNAP benefits. And literally, it's just a tax break for the billionaires. The people who are already wealthy, they're just going to be making more money, while people who make like less than $50,000 a year are going to actually be making less money. Like, my thing is, if there's the 1% who is extremely wealthy and is hoarding all of the wealth, and then everyone else is just, living paycheck to paycheck, or everyone is just, trying to get by, are these like billionaires and like company owners and CEOs not aware? Like, if you guys are hoarding all the wealth, like, nobody's going to be able to afford shit from you guys. Like, if Medicare gets cut, Medicaid and SNAP, and people have to come out of pocket to pay for all of those things that they actually had the benefits for, then they're not going to be able to afford all the other capitalistic shit. So, like, these companies aren't going to be actually getting the money that they think they're going to be getting. Like, I kind of think that this is going to be backfiring because people are not going to be able to afford shit from these large companies. They're just going to get the basic things that they need because now they're being literally forced to pay for things that they had the benefits to cover. Because now all of a sudden we're just going to get rid of a bunch of benefits so then the extremely wealthy people can earn more money per year. That doesn't make any fucking sense. But the thing is, I feel like it's just going to be their karma because no one's going to be buying shit from any of these large companies. Anyone who's hoarding the wealth is not going to be getting any more wealth because you guys are hoarding it all, number one. And number two, nobody literally can't afford to buy any more of your shit. It's not even like they're choosing not to, like a boycott. It's like they actually can't afford to do that. So, but yeah, that should be interesting to see. But it's still horrible that they cut all of these benefits. Like, what the fuck is actually going on?
You know what blows my mind? We just saw a court sign off on cutting Medicaid funding to Planned Parenthood. And somehow people still don't understand how dangerous this is. Planned Parenthood isn't using Medicaid money for abortions. That's already illegal under the Hyde Amendment. The money was covering birth control, cancer screenings, STD testing, and basic health care. Now, because of this ruling, 1.1 million patients might lose access to their health care, and as many as 200 clinics may shut down. Whole communities, especially low-income and rural areas, could lose access to their only health care provider. And the same people screaming for empathy for a hateful man will be the ones cheering this on, while showing zero empathy for the folks that are about to lose access to basic and even life-saving care. This isn't just about abortion. It never is. This is about control. It's about telling people, mostly women, low-income folks, people of color, that their health and autonomy don't matter. This is yet another example of authoritarian policies. They don't have to ban everything outright. They can just strangle the resources until the choice disappears. And that's exactly what's happening right now.
Court cuts Planned Parenthood Medicaid. 1.1M lose birth control, screenings, 200 clinics shut. Not abortions, already banned, but control over women, poor, POC. Rural areas lose sole providers. Agree. Empathy for haters, none for suffering? Dangerous. Authoritarians strangle resources quietly. MAGA cheers while health autonomy vanishes.
This may sound morbid, but I'm so glad my parents are no longer here. I promise you that. I remember the last time I talked to my mom on the phone, that was the happiest I had heard her in a long time. They're cutting so much from Medicaid, Medicare, and the SNAP program. People are going to be out here fighting for their lives. They're going to be out here starving. Children will be starving. Because if they make those cuts and they say, oh, well, you don't qualify for food stamps, that also bleeds into school lunch. It bleeds into so many things that children will not be able to qualify for due to no fault of their own. My parents lived off of Medicare. They had to have Medicare. I can only imagine how hard it would have been for them to live through all of this. Through all of this as elderly people. It is not fair. It is not right. And this is going to impact so many people using these terms of words like impact, and people are going, they're getting numb. We're becoming numb to these terms. People just scroll past videos like this that talk about it until it actually hits home for them, until it actually manifests itself into the physical form in their lives and impacts their financial setting, impacts their financial pockets. Like, people aren't thinking about WIC. They're not thinking about the fact that children need formula to live off of. And you're planning on cutting off SNAP benefits for children who are 7 years of age or older because their parents aren't married, or maybe because the mom is a single mother, the father is a single father. So children that are 7 years of age or older don't deserve to eat? And y'all aren't giving people jobs? What the hell is going on? What the fuck is going on?
Maggots, take a guess how much you're going to be in debt thanks to that wonderful president of yours. $3.4 trillion. And you tack on a little bit of interest over 10 years, you're up to $4 trillion in debt. So you say to me, well, it won't affect me. Well, maybe not. If you're like me, we'll be dead, but it is going to affect your kids. In fact, 10 million people will lose their Medicaid, and 5 million will lose Obamacare. So that's 15 million people are going to lose their health care, and yet it's going to cost you $4 trillion. Where the hell is all that money going? You're going to wish you hadn't voted for him. It's coming. I'm telling you, it's coming. And I don't have the energy tonight to scream, wake up!
Our country is trying to kill us by separating us from our health care. They're killing us. This year, 70,000 people will die due to lack of access to health care.
Glad Parents Gone, Medicaid, Medicare, SNAP cuts, starve folks, kids too, bleeds to school lunches, formula. Single parents, kids over 7 don't eat, no jobs given. Impacts numb till personal. 70K die yearly from no access, like daily jet crash. More with changes, 55K extra, abominable. Waste trillions on profit motive, need single payer. Agree, twice other countries spend for worse care. MAGA, your wake up ignored, now debt soars.
70,000 Americans will die. That's as if a jetliner crashed every day in the United States. So we were outraged when Boeing had 2 crashes internationally of their jetliners, but every day a jetliner is dying. People are dying here in our country because of lack of access to health care. Now with the changes that our speaker spoke about today, more people will die. An estimated additional 55,000 people will die because of these changes. That's over 100,000 people will die every year because of lack of access to health care. That's abominable. The only way to change this is to take out the profit motive in health care. So right now, because of all this administrative burden, we are wasting over $1 trillion in healthcare dollars. We spend more money than any other country on healthcare. We're spending nearly 20% of GDP. Other countries spend 10%. We're spending twice as much. It's ridiculous. We need a national healthcare system. We need single payer. We need
Stop scrolling, please. This is not a drill. I need people from the following states: New Jersey, Arizona, Ohio, Oklahoma, Texas, and Washington, as well as everybody else, to listen to what I'm about to say. A new pilot program using AI in Medicare is being piloted in these 6 states and surely will spread out soon. In this pilot program, AI is going to be used in the prior authorization process to decide whether you should get your medical treatments or not. Not doctors, not medical professionals, AI. And here's the really scary part. The tech companies that are going to be making the AI programs that this pilot study is going to use, they get a kickback, money, each time they deny a claim. Now tell me, being that that's the case, do you think that they're more likely to approve your recommended medical treatments or not? So far, when AI is used, their denial rate is about 90%. And there's quite literally a financial incentive for them to deny you your medical treatments. As a reminder, the population that gets Medicare is people 65 and older, and if you are under 65, people with disabilities. I remember when all of you were saying, oh no, they're not coming for people with disabilities or the elderly. What did we tell you? This is sick. This is eugenics. I am from New Jersey, so Phil Murphy, Cory Booker, Andy Kim, where are you? What are we going to be doing about this? I need for people to realize just how bad this is going to be.
So, trending on social media right now, there is a woman asking why her father is being kicked out of his nursing home by September, and he's on Medicaid. So let's talk about why this is happening. Across the country, nursing homes are cutting ties with Medicaid residents, not because they want to, but because they can't afford to keep them. Medicaid pays some of the lowest reimbursement rates in the entire healthcare system. And in many states, those rates haven't kept up with inflation, staffing costs, or increased medical complexity. So nursing homes are losing money on every Medicaid patient that they currently care for. This crisis didn't start overnight. Under the Trump administration, Federal policy pushed for Medicaid cuts, block grants, and privatization, what he likes to call the Big Beautiful Bill. That agenda sought to limit federal Medicaid funding and shift the financial burden to states. So now in 2025, we are living with the consequences. The COVID-era protections that paused redeterminations are long gone. Medicaid unwinding has dropped over 20 million people. And with fewer residents covered and payments still too low, nursing homes are making hard financial choices. So some are shutting down entire wings. Others are refusing new Medicaid admissions. And yes, some are discharging long-term residents. So if you're asking why your father is being kicked out, the answer is because the system is being defunded on purpose. When you vote for politicians who promise to shrink entitlements, this is the real world result.
Nursing homes dump Medicaid folks. Low rates, inflation lag, Trump cuts, block grants. 20M dropped post-COVID. Wings shut, discharges rise. System defunded on purpose. Many lose Medicaid unaware. State names like Star, Cal-Aim hide it. Agree? Suffering not their fault. Gov abandons. MAGA, your trillion debt votes kill access. Harsh reality hits home.
Elderly people getting eviction notices. This isn't just bureaucracy, it's policy. And it's hurting families like yours right now.
A woman on Twitter said that a lot of people are about to lose their Medicaid and not realize it because their insurance is called something else in their state. Perfect example would be Texas, which is Star or Star Plus, CHIP, Georgia Pathways, New York State of Health, California, Cal-Aim or Medi-Cal, Maryland, Health Choice, Illinois, Health Choice Illinois. These are just some examples. And people really don't know that their insurance is Medicaid because they don't know what the real name is. I mean, even Florida has an acronym as SMMC. If you're not paying attention, you wouldn't even know that that's Medicaid. All I'm saying is that a lot of people are about to suffer, and it's not a fault of their own. It's just the government doesn't want to help you.